patient is a 79-year-old Asian female. She was readmitted with a fever of 101.5 and diarrhea. She was dismissed from the hospital 1 week ago and has been in the skilled nursing unit receiving antibiotics for osteomyelitis in her leg. She's been placed on contact precautions and has a stool sample for C. diff that has been ordered. Her laboratory work comes back and reveals that she has an elevated white blood cell count and elevated neutrophils. Her family just arrived and they were very confused why everyone was wearing masks and gowns in their mother's room. They also think that their mom may need more services when she goes home and would like more information about what community services are available for their elderly mother. Some of her relevant cues include complaining of abdominal cramping, fatigue, and weakness. She has pain in her left leg where the osteomyelitis is. She has anxiety and confusion about the isolation precautions and her ability to return home. She has a fever of 101.5. She is tachycardia at 110 beats per minute and hypertensive at 140/96. She has a high respiratory rate of 24 breaths per minute, decreased urine output and dry mucosa, diarrhea, redness, swelling, and drainage from her osteomyelitis site, elevated white blood cells and neutrophils, indicating a possible bacterial infection and hypokalemia.
So our top 3 diagnoses are C. diff, which our cues are diarrhea, abdominal cramping and discomfort, fever, elevated white blood cell count, neutrophils, broad spectrum antibiotics, and the patient on contact precautions and stool sample for C. diff ordered, hypokalemia, tachycardia, hypertensive, tachypnea, dry mucosa, and decreased urine output. Our second diagnosis is osteomyelitis, and our cues include pain in the left leg, difficulty moving and using left leg, fatigue, redness, swelling, or drainage, fever, elevated white blood cell count, and neutrophils. And our last one is dehydration, and our cues for that are a dry mouth and decreased urine output. Cues we are unsure of are anxiety and confusion about isolation precautions and ability to go home. So our top priority and concern would be the patient's diarrhea and dry mucosa and decreased urine output and the hypokalemia, which all indicate dehydration. So we want to get her some water or moisturize her mucosa, as well as start her on antibiotics to prevent any sepsis that may occur. So our goals. So our short-term goals for this client would be the patient will adequately be hydrated by the end of the shift, proven by improved urine output or greater than or equal to 30 milliliters an hour, improved mucosa moisture, and improved skin turgor. Long-term, the patient will demonstrate effective management of her infection and hydration status by continuing to produce greater than or equal to 30 milliliters of urine, have a normalized potassium level and white blood cell count, and understand the importance of adhering to her antibiotic regimen by discharge.
Hello, how are you doing?
Good. I just have a few questions for you.
Okay, what's up?
So why does everybody that comes in my mom's room keep wearing masks and gloves and gowns?
Okay, so we're wearing masks because her white blood cell count is a little bit elevated, so we just want to make sure to protect her from our germs. And then with the gowns and gloves, she's on contact precautions right now because she has C. diff, or she might have C. diff, and we sent out a stool sample for that to get tested. So until that comes back negative or positive, we're going to keep it on. If it comes back negative, we can take them off and she can go back on regular precautions. But if it comes back positive, we're going to keep her on contact precautions for the C. diff, which means the gowns and the gloves.
Okay.
I also just want to let you know that it's very important that you guys also wear gowns and gloves when you come and visit her, and then masks for the time being just because she might have an infection because of that white blood cell count.
Okay.
I also want to talk about making sure you're washing your hands and not just using hand sanitizer, because hand sanitizer does not work on C. diff. So always make sure you're washing your hands, and I will show you, how to completely wash your hands correctly and all that jazz. And then I will also be sure to educate you on how to properly apply and take off that PPE so that you do not spread any of those microorganisms.
Okay.
Good morning. How are you doing? Oh, great.
I'm sorry to hear that.
Can you tell me what my medications I'm taking are?
Oh, absolutely. So we have you on Flagyl. We have you on 500 milligrams through your IV every 8 hours. Flagyl is a bactericidal anti-infective drug, and we are giving you that for your C. diff. We might expect to see you have some nausea and vomiting, maybe some dry mouth and some diarrhea, but we can help take care of that. And if you did have any severe renal impairment, we would go ahead and hold this drug, as well as if you were taking any drugs that could give you nephrotoxicity. We would want to watch out for contradictions there. And as your nurse, I'm going to be keeping an eye on your CBC with differential and your LFTs. And then we also are taking vancomycin. We're doing that 1 gram through your IV just once a day. And that is also a bactericidal agent that's going to bind to precursor units, stopping bacterial synthesis. We are using that to treat your osteomyelitis. And we are going to want to watch out for any ototoxicity or nephrotoxicity. And again, if you had any history of vancomycin hypersensitivity or renal impairment, we would go ahead and hold this drug, as well as if you were taking any drugs that could produce nephrotoxicity, we would want to watch out for those as well. And I am, as your nurse, I'm going to be watching out for your audiometry, your creatinine and your BUN, as well as your serum vancomycin concentration. And one last thing, since these are both antibiotics, you want to make sure to take the whole dose. And even if you start feeling better, you still need to finish your prescription.
Got it.
Hi, my name's Landry. I'm going to be speaking to you just about some resources you can use once you get out of the hospital, because you might be feeling a little bad. So the first one is called the Senior Care Act program, and this is just going to help you with some of those things you do every day that you might need help with. You might feel a little weak. So bathing, dressing, feeding yourself, laundry and housekeeping, managing all those medications you're going to go home on and treatments, and then shopping, transferring from different places in your house, transportation, using your telephone, and walking. And this resource will benefit you because it's going to help you do all those different things that you do every day. And this option is more of a long-term thing. So if you're still feeling bad after 90-day period, then you're able to use this. And then the second resource that I have for you is called the Older Americans Act. It's a 90-day hospital transition program. So this will just be available for 90 days after you're discharged. And they are just going to help you with transportation services, case management help, any information and assistance you might need, in-home services like personal care, chores, homemaker assistance, any legal services that you might need, mental health services, adult daycare even. Senior centers that are going to coordinate and integrate services like community meals, community education, health screening, any exercise and health promotion that you might need. And this is going to be a great resource for you just for those immediate 90 days, and then after that we can look at more long-term options. Do you have any questions?
No.